This is Karen Ranzi, and I am here in Florida with Tasha Lee, author of Healing Diabetes with Fruit.
Yes.
And that is a title that's really fascinating to me. I'm going to ask Tasha about that today. And Tasha has had some major challenges, first with diabetes and also with epilepsy. And Tasha, can you tell us about your diabetes and epilepsy and how you're working to heal yourself?
Sure. Yes, so I was diagnosed with type 1 diabetes at the age of 11 and epilepsy at the age of 13. And I believe now, looking back, that it was very connected to the vaccines that I got at that time, which have been linked to both of those. So I dealt with that for most of my life. My diabetes was not in good control at all, and I had seizures a lot, got off in, when the ambulance and all sorts of lovely hospital visits. But after I recovered from my eating disorder, which was many years of terrible blood sugar control and seizures, I had to learn how to nourish my body in an unselfish way, which led me to a raw food diet, which led me to a fruit-based raw food diet. So I did very well eating mostly fruit and other raw, fruits and vegetables, lower in fat, and I stopped having seizures, and my diabetes was in the best control of my life, and that's where it has stayed. I got rid of my diabetic retinopathy, lots of wonderful things, much more sensitive to insulin.
Can you tell us any other symptoms that were improved by going to raw foods?
Diabetes related or in general?
In general, and diabetes
okay.
as well.
Yes, all sorts of things. So I found out recently that I've actually had Lyme disease for many years, and so a lot of the symptoms I had, joint pain and gut problems and brain problems, all sorts of things, got better on this raw food diet. And so now I'm learning that was the cause of it the whole time.
And so some people will say, well, can you, elaborate on what exactly it is that you're eating that has claimed this healing for you?
Would you like me to?
Sure.
Okay. So I do eat most of my calories from fruit, so I've gone through a variety of approaches. What I did at first was a lot of green smoothies. So I threw like a big container of greens and like 5 or 6 bananas into a smoothie, and maybe some water, and that was really helpful in transitioning because the greens have a lot of fiber, and so when I was coming from my terrible diet, I had a lot of fat clogging up my system and making me not sensitive to insulin. So eating fruit at that point was kind of a little crazy, so I needed some time to transition. So the green smoothies really helped with that. So I did a lot of green smoothies and just different fruit meals. I mean, like now one of my favorites is mango season, where I'll eat like 4 or 5 mangoes for a meal. I did a lot of meals, like evening time meals, out of non-sweet fruits. So I would like use raw zucchini and make spaghetti. You can spiralize it, and then I would make a sauce out of fresh tomatoes and basil and stuff like that. But a lot of just fruit meals, very easy. So like a bag of grapes. There's some things that I had to do as a diabetic. Since I have type 1 diabetes, I have a lot of friends who eat this way who got rid of their type 2 diabetes, and that's what my book is about, those who have type 2 diabetes who totally get rid of it by eating this diet. As a type 1 diabetic, it has really helped me, but I still take insulin to stay alive. But yeah, a lot of very simple fruit meals. So like exercising before eating always helps, being active, making sure I'm taking care of mineral needs, because we can get low in minerals, which will affect our blood sugar control in a bad way. So that's another thing to take a look at. The greens really help with that.
Right. You had also talked a little bit about parasites. Can you cover that a little bit?
Sure. Parasites are actually, I found out, really related to a lot of symptoms that people have, and we have no clue that they're from parasites, but basically everybody's got parasites. Some of us can be more affected by them, especially if our immune function gets low. So diabetes is very related to parasites. There's actually diabetes medications that are anti-parasite, antifungal, and that's why it helps people. So it's definitely very related. So I've been doing parasite cleansing, and it really has been affecting blood sugars. A raw food diet is naturally parasite cleansing, which is probably one of the reasons that it helps people. Also, parasites can really steal our nutrients. So I have noticed as I cleanse parasites, I have not had to take as many supplements. And so, like I said, like if you're low in chromium or vanadium, these things can cause problems with blood sugar. So if you're getting rid of the parasites that are stealing those nutrients, and also supplementing because our soils don't have the nutrients they're supposed to have in them. So these things can affect our blood sugar, and we have no idea. So yeah, doing some things to clean house and get the nutrition that our body needs helps it do the work that it's supposed to naturally take care of our blood sugars.
And where are you getting your minerals from?
Well, I was doing minerals from greens, lots and lots of greens, but I found actually that adding in juiced barley grass powder has been a more dense source of minerals, and I don't crave greens as much now that I'm using that. So that's been really helpful for me for minerals.
Cool. Thank you so much, Tasha.
Sure.
Amazing. And so great to hear that you're feeling good.
Thank you.
Yeah, that's wonderful. Okay, thank you.
Bye.